hormone and why do we care? Well, hormones are what keeps us going. They're a chemical messenger that tells our cells to act in a specific way. From the ages of 20 to 50, our hormones drop about 50%. So does that make sense that maybe that's a key as to why we feel different in our 40s and 50s and 60s? Wouldn't that make sense? What are some of the symptoms that maybe brought you here today? What do you think are some of the symptoms we're going to talk about today? Tired. Okay. What else? Anybody? Weight gain. Night sweats. They're coming up. Hot flashes, premenstrual syndrome, mood swings, migraine headaches, hot flashes. So we want to try to relieve a lot of these symptoms. As Suzanne Summers says, the 7 dwarves of menopause: itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. I'm sure some of you have felt some of these at some time as you're in perimenopause or menopause. So the first question I always get is, well, are hormones safe? We have been scared into believing that hormones are bad for you. Well, if hormones are bad for you, then why do we feel so great in our 20s and 30s? Are they bad for you? That's what we're going to talk about. Should I, or do I even need to take hormones? Why do they go away? Am I supposed to feel tired? Should I take prescription synthetic hormones? And why am I tired and gaining weight? So how do hormones affect different people? Premenopausal women, a lot of women say to me, well, you only treat menopause, right? No, we treat a lot of women starting in their 30s and some even in their 20s who are dealing with conditions like infertility, polycystic ovarian syndrome, endometriosis, fibroids, irregular heavy cycles, premenstrual syndrome, and migraine headaches. So and even postpartum depression. That's a big part of what we do. For menopausal women, of course, we treat those hot flashes, those night sweats, vaginal dryness, that brain fog, the dry skin, and the low libido. And for men, that lack of motivation, decreased energy, that pot belly, the low libido, decreased muscle mass, and again, the brain fog. So, are hormones safe? So we do have several studies that indicate that these synthetic hormones can have some potential for increased risk of cancers, such as Premarin. It can increase the risk of heart disease, the risk of cancer, the risk of stroke. So this is the big WHI study that was halted in 2002 when every woman stopped their hormones. We were worried about that same increase of breast cancer, heart attacks, and then 2004, the estrogen-only arm was halted due to increased risk of stroke. So are most of you familiar with those studies? Heard about them a few years ago? So we have 13 studies that document that non-bioidentical progestin can increase the cell replication in the breast tissue. We have 7 studies that show that bioidentical progesterone does not induce that same breast cell replication. We have a study that showed 80,000 women who were using hormone replacement for 8 years. That had estrogen with non-bioidentical progestin had a 69% increased risk of breast cancer, whereas the bioidentical arm with progesterone and estrogen showed a significant reduction in breast cancer risk. So what is estrogen? We have 3 types. We have estriol, estrone, and estradiol. The use of estriol is one of our safest estrogen replacements and is not associated with an increased risk of breast cancer. The non-bioidentical estrogen is known to increase the risk of uterine cancer. Estriol does not increase the risk of uterine cancer. And estriol has been studied and shown to improve bone density, youthful skin, and enhance urinary and sexual health. Progesterone. If you look at your synthetic product, does it say the word progesterone? No, it does not. It says progestin, norethindrone, depo something. It does not say the word progesterone. We make progesterone. So bioidentical progesterone can affect cardiovascular health. It can decrease the risk of blood clots. It can protect against hardening of the arteries, and it can help us balance your HDL levels. We know that bioidentical progesterone we feel can actually protect you against breast cancer. We had 4 arms in this study that we looked at: estrogen only, the bioidentical progesterone only, the bioidentical progesterone and estrogen, or a placebo. And these hormones were applied to the breast 12 days before surgery. So in the estrogen alone arm, there was a 62% increase in the breast cell proliferation. In the estrogen and progesterone arm, there was a decreased estrogen breast cell proliferation, and in the progesterone alone, a 66% lower breast cell proliferation than the placebo. So this is all a bunch of detailed information to tell you that we have good data that the bioidentical hormones, which are the actual words estrogen and progesterone, can be safe. We have also literature that shows a strong connection between your for women, your progesterone level and a risk of breast cancer. This study measured levels of progesterone in almost 6,000 premenopausal women. The women with the highest levels of progesterone in premenopause who had regular cycles showed an 88% decreased risk of breast cancer. They had another study of around 1,000 women over 33 years that showed women with deficient progesterone levels had a 540% increased risk of premenopausal breast cancer. That's huge. And they were 10 times likely to die from any cancer. So that's how important balancing the progesterone is to keep women protected from cancer. So this is what we are all about. We are going to talk to you about natural hormones. So what is a bioidentical hormone? It is a hormone that is created to match exactly what's in your body. The words estrogen, progesterone, testosterone, DHEA. We do not have a funny name to it. It is not synthetic. It matches exactly by 99% what that hormone is in your body. Whereas the synthetic hormones are around 6% structurally equivalent, and your body doesn't know what to do with them. This is a great quote from Oprah. She said she'd never had a hot flash, but after reading Suzanne Summers' book, she decided to try the bioidenticals. After one day on the bioidentical estrogen, I felt the veil lift, she wrote. After 3 days, the sky was blue, my brain was no longer fuzzy, my memory was sharper. I was literally singing and had a skip in my step. On the show, Oprah had her own word of warning for the medical establishment. We have the right to demand a better quality of life for ourselves, and that's what doctors have got to start respecting. So what happens to these hormones? Well, we typically develop for women a stage called estrogen dominance. So again, as I mentioned, your hormones drop from the ages of 20 to 50. Around 35 to 40, we see a more dramatic decrease of that progesterone. And then estrogen becomes our dominant hormone, which leads to the symptoms that are listed on the next slide, such as that PMS symptom. When your family's like, are you about to start your cycle? You know that's a bad sign. Breast tenderness, headaches, those migraine headaches, the weight gain, the mood swings, and just feeling achy and tired. So this is a slide that shows you how quickly and rapidly that progesterone level starts to drop. So how do we figure out what to do? We have a great hormone analysis that we use in our clinic from Genova, and that shows us several of the different estrogen levels, E1, E2, and E3, your progesterone, your testosterone, DHEA, and some estrogen metabolites, so we can see, is your body in a protected area against breast cancer or not? So once we're able to look at this and listen to your symptoms, we can figure out what type of imbalance is occurring, and are any of these some of the things that we need to look at, such as perimenopause, menopause, fibrocystic disease, sexual dysfunction, or breast cancer. We can prescribe bioidentical hormones in several different forms. If you go and have a synthetic hormone, there's usually 1 or 2 doses at the most, and it's typically always oral or in a patch. We can use creams, we have capsules, we have a troche. So our compounding pharmacies can make a specific dose exactly for you, and your body's going to change. It's not going to stay static. It's not going to be exactly the same every day for the rest of your life. So we're able to adjust your hormones with you and able to adapt and help relieve the symptoms if they reoccur. So Premarin, of course, is the most common one that has been used for a long time. Do you all know where Premarin comes from? Yes. A horse. So pregnant mare's urine. Why would we put pregnant mare urine in our body? Would a man put pregnant mare urine in their body? No, never, never. Wouldn't happen. But it's okay for us to do that, right? No, it's not. So, what about men? Well, andropause is the male version of menopause, but it's a little more gradual and more of a steady decline in testosterone. I will tell you that I have younger and younger men coming to me with testosterone deficiency, which is quite interesting. But again, we do believe that a lot of the hormone changes are declining more rapidly due to the amount of stress that we have. So again, from around 20 to 40, we see about a 50% drop in testosterone levels, and from 40 to 50, a little more rapid decline. So here are some of the signs and symptoms of low testosterone. You lose the muscle mass and strength, decrease in the size of the penis, the erection difficulties, decline in libido, that increased body fat around the waist, lower sperm counts, and diminished stamina. A lot of my male guests will tell me, I just can't get a lot done in a short period of time, whereas once I treat them with testosterone, that's their primary reported improvement, is that they can accomplish more than they used to. So we use biologically identical human testosterone as well. We can get that in creams or gels, or we actually prefer injectable. We found the best results with the injection. And again, if you go to your regular physician and they give you androgel, or some of the synthetic forms of testosterone, we found that it's really not as helpful. So we have some studies that show that low testosterone can develop metabolic syndrome, diabetes, and cardiovascular disease. So again, just like for women, replacing these hormones is important to protect you from disease. So we always get the question about prostate cancer. So I always ask my male guests, well, were you worried about prostate cancer when you were 20? Were you? No? Were you worried about it at 30? No. Where do you get worried about around 40 to 50? What happens around 40 to 50? The levels start to decline. So we actually feel that balancing the testosterone may be actually helpful and preventative for prostate cancer. And in some circles, they are actually treating prostate cancer with testosterone replacement. So this is the relationship of prostate cancer and the testosterone level. So isn't that interesting? So we also have a recent study that showed that elderly men in the highest quartile of serum testosterone levels have a 30% lower risk of cardiovascular events over 5 years compared with men in the lower 3 quartiles. So we know that there's some association, again, with testosterone deficiency and the development of cardiovascular disease.